We've heard lots about the different online consultation providers and how they can help you in general practice and also help your patients. How they work across organizations, whether it's across different practices, across networks, or even across larger footprints and stuff, that's the bit that sometimes doesn't always work. In this episode, I'm joined by Gareth from Blinx Healthcare as we talk about PACO Connect, a solution that can help connect those different parts and make that journey not only for your patients really easy and simple, but also for you in practice. Let's tech enhance your primary care and learning. Hello, EGP learners, and welcome to this episode where I'm really happy to be joined again by Gareth from Blinx. How are we doing there, Gareth?
Very good, thank you. How are you?
Yeah, ticking on. So just to mention, this is a live work environment. So Gareth's out and about doing loads of cool things, but we are about to show you PACO Connect. Now, this is a really interesting tool that we briefly talked about when we covered PACO GP, which is the online consultation environment thing. It's much bigger than that, to be honest, let's be clear. But I know that we're going to talk more specifically around PACO Connect, a tool that I think is amazing. So let's have a look at it, shall we, right now, Gareth?
Be great, let's do it.
Yeah.
So just before we jump into that, a quick reminder, PACO GP is the end-to-end practice solution and for PCNs as well. So as you can see, we've got a number of different features, but really the idea here is that all of those features and functions that are in one place, so not lots of different bolt-on systems, are able to be leveraged across the network. So in this visual here, what you're seeing is a PACO Connect system sitting atop of all of your individual practices where you have PACO GP, and patients can be referred into and self-book into network services, cross-org right back from PACO Connect back into the home record is all enabled through PACO Connect and PACO GP working in tandem.
And just to be clear, that is system agnostic, so it doesn't matter what platform your practices are on, whether it's System 1, EMIS, and I'm assuming at some point Vision as well?
Yeah, exactly that. So we're going through this as IM1 providers, so this should be system agnostic. Certainly leading, as we've talked about in previous sessions, with some providers over others, and as you say, even the likes of Vision will be there at some point in the future.
Yep. And just to mention as well, you mentioned the write back feature, which is the cool part. So obviously anything that's then done with the PACO interface and stuff will then be written back into the patient records. So you're not having to worry about using different systems as well to capture the data.
Exactly that. And we'll talk about it later, but not just the write back of problems, comments, consultation notes generally, but also ensuring that appointments are appropriately booked to not miss out on those GPAD data capture.
Awesome. So shall we have a look at a couple of examples?
We shall. I thought it'd be good to start with a patient journey. So we all know that we've got PCNs, federations, and different groups of healthcare systems joined up to provide services en masse. And through our digital front door, which could be hosted at your practice, it could be hosted at your PCN or your federation, you will provide a set of options for your patients to engage with and use themselves. So in this example, we've got some self-book connected services as an example. So we've got self-refer, physio, PCN, and various different things. And what we want to happen is that a patient just selects the service that they require. And whether that's delivered by a PCN or a local practice is really not for the patient to worry about. They can be told where to go and who to see. And we want the system to do the work for you here, and certainly not have the staff to have to do all of that work. So I'm going to look at some network services, and I've got a scenario that I built here for us today for the EGP learning audience, and that is to self-refer into contact physio. Now, as you saw with PACO GP, and I'm not going to go over that, you can have a link to a health form to have a patient populate some data, or you could have a booking link, or both. And I think that's something to bear in mind. Those scenarios are completely flexible. So in this case, I'm going to enter the details. Remember, if your patient doesn't know them, they can click on the link and go straight through to get that information back. So they're very clear on what their NHS number is if they're not sure. I can send a secure code, and if I know that as a patient I don't have an email or I don't have a mobile number, then I can take off one of these flags. I'll send the secure code, and then I will receive that via SMS and or email.
A few moments later.
Okay, so I've got my SMS code and a little conversation says, "Hi Gareth, this is an invitation to book your physiotherapy appointment. Your 6-digit code is," and that takes me straight through to a pre-configured, in this case, booking link. So I, as the patient, I'm going through. It's only a face-to-face, tells me the location. I view the date, and on this occasion, I'm going to look to see if next Wednesday or Thursday, I'll go for Thursday, is available. And it is. Remember, with PACO, generally, we try and put these times in blocks so that you don't have two patients clashing on the same slot and getting disappointed and then calling the practice or the PCN and complaining. So now the patient is very clear of where they're going, who they're seeing, and what it's for. We might want a reminder, so I can select that. And at this point, again, really, really important to point out, if as a patient, either now or any point in the process between now and the appointment, I need to change something, I can. So I can go back to my link, get into the same patient hub flow, reschedule or cancel the appointment. So that's kind of a quick view of the patient journey. So if you're happy with that, I'll move on to the...
Just before you do, so I've not seen other places that allow you to reschedule. That seems new to me.
Yeah, it's a feature that we pushed hard on because we realized that a lot of the problems that would happen with booking links is it's a one-way flow and it's like a non-return valve, right? You book your appointment and you have no opportunity to, you know, change, edit that. Things happen. You know, you need to pick the children up as an emergency suddenly, or family members get sick, or you have to work. And so it's really important to give the patients that flexibility. And we've seen the DNA rates through Blinx booking links be less than 1%. And so we can see the impact that's having.
Less than 1%. That's
less than 1%.
Awesome.
When a patient reschedules, the availability of anything that might have changed in your appointment books is real time. So it's not like a cached view of the appointment book. It's a real time kind of checking of the available slots. So if you know, put some extra slots on, so you increase the capacity, again, that could give the patient more flexibility and a greater chance of attending. So again, just to try and sort of frame that up a little bit more, why it's so important.
Sure.
So I'm going to ping us across to PACO Connect, which is part of the same suite of products. So if you've got access to PACO GP and then you kind of come on board with PACO Connect, it would all be in the one place. And I'm looking at the appointment book here, and as you can see, I've set up an EGP learning PCN appointment book.
The best really PCN in the country.
Absolutely. And what you can do when you publish, when you create an appointment book, is you can publish that to all practices that have got that sharing agreement with you that you wish to share. So if you've got a one practice that runs a phlebotomy clinic locally, you could create that as a session within an appointment book or as an appointment book itself. So within the configuration, really quickly, I'll show you. Just you go in and we can say, where is our EGP best PCN in the country appointment book? Here it is. And when I was building that, I was able to share that with 3 of my demo sites that I've got, so demo organizations inside of PACO Connect. So once we built that, and a couple of other things just to point out when you build up your configuration, slot types, we build them, but we make it so that you can add skills. So skills are requirements effectively in this sense. So there's a requirement for this slot type to have somebody that can prescribe or somebody that has minor ops capabilities or whatever it is. And we do that so that when we build the sessions and we apply those slots, it inherits that requirement. So when you're trying to map staff into this, you can make sure you get the right staff who can deliver that capability. And of course, there's generalists, so we're not trying to, obviously it's general practice, but we want to try and help you pinpoint the right skills and capabilities for that particular service that you're trying to deliver. So hopefully that makes sense. And I'm going to jump back into the appointment book, but any questions, please jump in and stop me.
No, I do, but let's keep going.
Okay. Well, in the appointment book, we'll just take a quick look. And I've had since my my message, which I'm sure we can flash up on the screen, for booking confirmation on the 15th, face-to-face with Mr. Derek Pierce. So a couple of quick things. If I'm a staff member looking in the appointment book, I want an easy way to find these things. So I know it's Derek Pierce. I could go in and filter on the staff role, the healthcare professional name, the patient, the slot type, the session, etc. But I just want to get rid of the empty and the available, and then I'll fly across. I could look at this as a week or month view, but I'm going to go to the 15th and then look at Mr. Derek Pierce. And here are my 2 appointments, and I was indeed the 8 till 8:10. So that is me there. And from this point, I can take the patient through the journey as a first contact physio. So it doesn't really matter what kind of appointment session you want to run or what kind of clinic or service you want to deliver within PACO Connect. We let it all be run by our quick forms. And our quick forms are a method the same as our health forms that you can build a template. Everything can be coded or it can be free text, and you have the option. So I'm just going to open a very basic consultation form, which I've probably used in a previous demo. So apologies if this is not very exciting for some people, but this is a Blinx Healthcare consultation form. I can say presenting complaint. I can type my free text. If you did want to dictate here, you can. You use your Windows H that accesses your microphone, and you can just speak into the application. If you want to then choose, and this is certainly, this particular scenario is running into an EMIS backend test environment. So in that case, we can do things like state whether it's a problem, whether it's an examination, where I want to put it within the consultation mode. I could choose any SNOMED code again. So if I am saying this is an asthma review, maybe I could have all the codes preloaded as quick picks, but I'm just going to show you a very simple example. Once I've done all of that, maybe I want to have some examination values or post it across, we can save and submit the consultation. And when we've done that, that will all be written back to the patient's record as a consultation or as a problem, or whatever you've done within this process. So I'll just pause at that point, see if there's any questions on that.
No, so as you said, regardless of which practice you're working from, this allows a write back feature into the notes. So, whether you're working in PCN Clinic A, PCN Clinic B, it just sends it back. Yeah,
exactly. Think back to the diagram before. The idea is we want to get somebody into the service. We don't want to have that person log in and out of many systems. So they simply pick up the patient, do what they need to do clinically with the patient, hit save, and it writes it back, as you say, to the home record of the patient.
Awesome. So we talked about the write back feature, and it may be worth having a look at what that looks like in, for example, shall we have a look at EMIS?
Yeah, let's do that. So
yeah, so I'm just going to zoom in a little bit there. So that's that consultation there on the 8th. Yeah, there we go. So that's what it looks like in the notes in EMIS once you've used the write back feature from PACO GP.
Something else we've done just to make sure that this is really, as I said before, around GPAD capture, is the ability to go in and say, okay, I know that I want to put this back into the home practice. You might want to as a particular slot type. I'm using the example of untimed here, only because I know that there's slots available in the underlying system, and I can see live availability as well. So if I were wanting to record this somewhere on a blank session, so it doesn't have to be about availability, we just want to capture that work done, then of course that's there as well.
Sorry, to ask a question on that. So you could have templates of clinics on, for example, System 1 and EMIS that are empty slots allocated to, for example, administrative workload. And then this will allow you to write that back into that slot directly rather than having to allocate this patient to that slot.
Exactly that. And the other thing is you can predefine the particular form to be to a slot type already. So you don't even have to select it here, and it'll just do that automatically and pick up the next available slot in that session or that list.
Okay, that will definitely make the GPAD capture so much easier.
Yeah, I mean, look, this is what it is. Going out and working with practices, getting that feedback, understanding the biggest challenges, and then responding to that. And that's kind of our whole premise of Blinx. That's what we're trying to do. So I'm glad to hear that's the case.
Yeah,
the work
definitely.
is not in vain.
Mm-hmm.
So I guess the other thing I just want to show you quickly on PACO Connect, and there is obviously so much more as you can imagine, you know, all kind of joint sessions and all those kind of things that we would be able to do. It's how you'd book if you just wanted to book from here. So if you had an admin team booking in patients from the network into a shared service, we want to make that easy. And we want to make it guided. So of course you could use our Care Navigator, which is similar to the digital front door, but for staff. But if somebody's here and they just think, yeah, I've got a patient on the phone or in front of me, and I want to book them into that service. And this again could be local practice admin reception teams that are given access to PACO Connect to book patients in, no problem. So we can allow you to come to our solution, which is called QuickBook. QuickBook is supposed to be quick, that's the idea, but it's also supposed to be guided to make it easy, that you don't have to troll through the appointment, but trying to cross-section it and find where is that particular appointment that I'm looking for. And also it really tries to consider what's important to the patient. So what do I mean by that? Well, is it the date and time that's important? Because if so, already I can tell you that these things have filtered, because not everyone, not every clinician, not every appointment type or slot type or service is available today. This week, again, would drive a different set of filters. So I can start at that end of the QuickBook, or I could say the most important thing to me as a patient is that I see a particular member of staff. So I can select that. And then that again drives the decision tree. And you can see that all the mandatory fields have gone because a particular member of staff can only deliver certain things. So a quick way of trying to identify things, you know, features and factors that are important to the patient or important to the member of staff in trying to find the best outcome for the patient quickly to book an appointment. Once you've done that, you select the appointment. And again, thinking back to the previous episode around PACO GP, our unique booking links are a template to a slot type similar to other solution providers. However, what we do in addition to that, to avoid you having to reconfigure all of your appointment book and slot types and have one for, you know, Dr. EGP learning as a slot type, is you don't have to do any of that. You can map it to specific clinicians, a specific time window. So a patient receives a link for 2 staff nurses availability for the next 2 days for the flu jab availability is a really simple example. All of that configuration is built into here too. So if I say, well, actually, that time that you've proposed to me, it doesn't work for the patient, and they're saying that they've, you know, they've got to go to pick up their children at that point. Let's take a look. Let's switch it up. I'm skimming through what seems like an open-ended appointment book, but it's not. It's all pre-filtered still around all those rules and the selections that I've just made. So then I pick the time that's appropriate, and I say the 22nd at 8:30, and I save that. And I can send the patient a reminder as well. So now they're on the digital path. They get our confirmation. They can still reschedule. And they get a reminder to make sure that we hopefully get them to turn up. And that's all booked. So that's kind of just a view on how it could be a little bit easier to book in this solution.
Okay. So just so I understand from that point of view then, so you can set it so that a patient, for example, can self-book into a clinic. Let's take a smear appointment, cross clinicians based off the skills that they have. So that could be a nurse, that could be a GP who has the relevant training and skills to do smears, because, for example, I don't, and things. And then be able to book into that appointment across various different sites. If they needed to change it, they can use the same link to reschedule it and stuff. And you can set it so that it also will filter out to relevant time slots that you know are relevant for that patient. Say, for example, if that patient was non-English speaking as one of those criteria and had to be, for example, an extended appointment because they needed a translator booking, or from one link.
Absolutely. And that as well could be a slightly separate campaign for, language speaking, just to make it a little bit easier for you to manage the data that comes back in as well, because what often happens is when we're then using all of our analytics tools, we sometimes kind of end up trying to find that one criteria that's different between these 2 patients, and it was language requirement, versus maybe making the pathway separate. Language requirement, non-language requirement allows us to analyze that data a little bit easier. So yeah, all of the above, but a few different ways to look at that as well.
Wow. Awesome. So I can see that there's definitely going to be, like you say, practice, definitely some networks out there looking to use this, especially since it's system agnostic. Federations, you can absolutely see this working, you know, areas where they've got multiple sites, even ICBs, obviously this can work quite well, awesomely and things. What's the best way for them to find out more if they wanted to?
Yep, contact us. We have a contact address to reach out to us, which we'll pass the link so you can make it appear magically on the screen.
Yep.
You know, reach out to us through the website as well if you want to. But yeah, we'd always recommend to you know, come and see you and see what problems you're dealing with locally, because PACO is now quite a, you know, PACO GP and Connect are a big set of system processes and features and capabilities. It's really important that we don't get overwhelmed by what we could do in the art of the possible, and instead try and focus on your problems locally and try and address that in a really objective kind of way. So really good to have first demo, but of course the real detail is in sitting down and seeing what you are dealing with locally.
Definitely. I know the rate of change that you guys develop this stuff is astronomical. It really is crazy. Almost every time I've spoken to Gareth, there's a new thing there. If you want to check out what that new thing is, that's probably going to be right here. Alternatively, if you want to know more about PACO GP in more detail, definitely check out the episode myself and Gareth did just a few weeks ago. That's right here that explains PACO GP in absolute detail. And as always, we'll be here to help tech enhance your primary care learning. I'll catch you in the next episode.